Hello, let's talk about something many people worry about: dark teeth. You might feel a little shy when you smile. You might try to hide your teeth in photos. This is a very common concern. Many people come to my office with the same problem. Their smile doesn't reflect how they feel inside. It can make you feel less confident. But there is good news. You don't have to live with a smile that makes you unhappy. Modern dentistry has wonderful solutions. One of the best solutions is veneers. Thin, custom shells that can change colour, shape, size and length to give your smile a fresh start. First, let's understand why teeth can become dark. It's not always about not brushing enough. Foods and drinks are common culprits. Coffee, tea, red wine and dark sodas. These pigments stick to enamel and build up over time. Berries and dark sauces add to the staining. It happens slowly, so you might not notice day to day. Lifestyle matters. Smoking and chewing tobacco leave stubborn stains. Some medicines can darken teeth, like tetracycline in developing teeth, antihistamines, and blood pressure meds. An injury can bruise a tooth on the inside, turning it grey or black. Age and genetics play a role. Thinner enamel lets the yellow dentin show. Old metal fillings can make nearby tooth structure look grey. Root canal-treated teeth can darken over time from internal changes. Understanding whether your stain is on the surface or deep inside helps your dentist choose the best treatment. A veneer is a very thin layer placed over a tooth to improve its look or protect its surface. Think of it as a new, natural-looking face for the tooth. Veneers can address stains, chips, minor misalignment, and small gaps. There are three main types: composite, porcelain, and no-prep porcelain. Composite is applied in the chair in one visit, costs less, and is easier to repair, but stains more and doesn't last as long. Porcelain is lab-made, resists stains, reflects light like enamel, and can look very lifelike and last many years. No-prep veneers are thinner and sometimes need no enamel removal, but they're not ideal for very dark teeth and can look bulky on some smiles. Your dentist will help decide which option fits your goals and tooth condition. If your teeth are very dark, like grey from trauma or deep tetracycline staining, porcelain usually offers the best coverage. Porcelain veneers stand out because they combine strength with the right opacity to block darkness underneath. Very dark cases need proper masking. Thin or translucent materials let dark shades show through. Technicians build an opaque core to hide the darkness, then add translucent layers to mimic natural enamel depth. The result looks like a real tooth, not a flat, overly white chiclet. Take Sarah, one dark front tooth from childhood trauma. Whitening didn't work because the stain was internal. A composite veneer helped a little, but the grey still showed. With porcelain, the lab matched her other teeth and fully masked the darkness. That's why porcelain is the predictable, beautiful, long-lasting choice for dark teeth. Visit 1 is your consultation. Discuss goals, exam, x-rays or photos, and all your questions. Your dentist confirms if veneers are right for you. The preparation visit is careful and precise. A tiny amount of enamel, about 0.5 millimeter, the thickness of a fingernail, is removed to make room. Then a precise impression or digital scan is taken. Your case goes to a specialized lab and a master ceramist crafts your veneers. This usually takes 2 to 3 weeks. You'll leave with temporary veneers to protect your teeth and preview the look. You can test shape, length and colour, and request small adjustments before the final is made. On fitting day, your custom porcelain veneers arrive. Temporaries come off. Teeth are cleaned and prepared. Fit and colour are checked with you until they're perfect. They're bonded with a light-cured resin for a strong, permanent hold. After a polish, you'll see your new smile in the mirror. Porcelain veneers are a significant investment in your smile and confidence. Costs vary by location, dentist experience, and how many teeth. Porcelain often ranges from $1,500 to $3,500 per tooth. Composite is lower. Most insurance doesn't cover veneers because they're cosmetic. Care is simple. Brush with non-abrasive paste, floss daily, and keep regular checkups. Your team will use porcelain-safe polishing pastes. Avoid biting nails, ice, pens, and bottle caps to prevent chips. Wear a mouth guard for contact sports. If you grind at night, a custom night guard protects veneers. Veneers are low risk with a skilled dentist, but enamel removal for porcelain is irreversible. You may feel brief sensitivity to hot or cold, which usually settles in weeks. Veneers can chip or come loose and may need repair or replacement. Alternatives include whitening for surface stains, crowns for single dark teeth, and orthodontics for alignment. Identify your main concern, see a qualified cosmetic dentist, and consider your budget and long-term goals. Your smile is precious. If dark teeth hold you back, take the first step. You deserve to smile freely. Thank you, and don't forget to smile. Like, share, and subscribe.